Normally, the four pulmonary veins join the left atrium. In congenital anomaly, if they join the right atrium through one of the veins leading to the right atrium, it is known as total anomalous pulmonary venous drainage or even total anomalous pulmonary venous connection. Sometimes it is also known as total anomalous pulmonary venous return. If only one or two of the veins are joining the right side, then it is called partial anomalous pulmonary venous connection or return or drainage. If there is total anomalous pulmonary venous connection, survival is not possible unless there is a good atrial septal defect. A large AST in the presence of TAPVC is good for survival. And because of the mixing of blood in the atrium, in the atria, there is cyanosis. So it is a cyanotic congenital heart disease with increased pulmonary blood flow. Because of the left-right shunt across the atrial septal defect, there is both left-right and right-left shunt. There is pulmonary plethora and increased pulmonary blood flow. So this is one of the cyanotic congenital heart diseases with increased pulmonary blood flow. If the atrial septal defect is very small, then baby will present with severe cyanosis, needing some intervention in the newborn period. If it is very large, sometimes it may go on to adult life also without recognition, very rarely. There are three major types of TAPVC and one more type known as mixed type. Major types are supracardiac, intracardiac and infracardiac. Fourth is of course a mixture of all the three in combinations. This is supracardiac TAPVC. Pulmonary veins join a common venous chamber. From there it rises as a vertical vein and joins the brachiocephalic vein. From the brachiocephalic vein, pulmonary venous return reaches the right atrium. That is supracardiac TAPVC. So when the vertical vein is dilated, brachiocephalic artery is also dilated, superior vena cava is also dilated because of increased flow. So in the X-ray, it will roughly appear as a figure of 8 appearance. It is also called snowman in snowstorm appearance because this will be the head of the snowman and this will be the body of the snowman, and pulmonary plethora will be called as snowstorm. Another term for the X-ray appearance is cottage loaf. Cottage loaf is a bread with a small lobe and a bigger lobe. That's how the X-ray appears in supracardiac or type 1 TAPVC. In intracardiac or type 2 TAPVC, the common venous chamber drains into the coronary sinus. Coronary sinus will be dilated then and then into the right atrium. There is no vertical vein. Hence, X-ray will not show the typical pattern of snowman in snowstorm or cottage loaf or figure of 8. The drainage is within the heart itself. That is the intracardiac TAPVC. They will also have cyanosis and pulmonary plethora, everything depending on the size of the atrial septal defect. Next is the infracardiac TAPVC type 3. Here the common venous chamber drains downwards below the diaphragm. It is an infradiaphragmatic connection to the branches of the portal vein and then into the inferior vena cava. As it goes through the portal system, this is intrinsically obstructive, unlike the other two varieties. So this is probably the most dangerous in the newborn period. They will present with severe breathlessness, due to pulmonary edema, pulmonary venous obstruction. These are pulmonary veins. So when the outflow of the pulmonary veins are obstructed, that will cause pulmonary edema. That is infracardiac TAPVC. Obstruction to pulmonary venous flow can also occur in the supracardiac variety. That is because the vertical vein ascends between the pulmonary artery and the left bronchus. This can cause compression of vertical vein between pulmonary artery and left bronchus. This is known as hemodynamic voice. When the obstruction increases, pulmonary venous pressure increases. That causes transmitted back pressure, and the pulmonary artery also dilates due to increased pressure. Pulmonary hypertension will occur. That will increase the compression. And this is a vicious cycle. That is why it is known as a hemodynamic voice. This can occur in supracardiac variety also. When the newborn baby presents with severe cyanosis due to a tiny restrictive ASD, the emergency bailout procedure is a balloon atrial septostomy. Balloon catheter is introduced through the umbilical vein into the inferior vena cava and across the intraatrial septum, and then the balloon is inflated and pulled down quickly so that it will tear the intraatrial septum, producing a fairly good sized atrial septal defect. This can be done only in the early newborn period with a thin septum. When the septum becomes thicker, this may not be possible. And there were procedures known as blade atrial septostomy. The usual procedure is balloon atrial septostomy in the early newborn period. After that, child will improve, cyanosis decreases, saturation improves, acidosis decreases. Then after stabilization of the baby has to be taken for total correction of the defect. That has to be done in other cases as well.